Thank you very much, Simon, for inviting me. I'll have to negotiate glasses, no glasses. That's an age-related issue. Microphone. Thank you for telling me, and tell me if I'm not getting it wrong. Yes, so as Simon said, I'm a consultant clinical psychologist, and I specialize in trauma and in particularly in post-traumatic stress disorder. On the next slide, Raymond, I've summarized the work that I've been involved with over the past 3 decades, because that work has shaped the perspective that I'm going to share with you today in relation to the topic of violence against women. I can see it's a little bit small, but in the last 3 decades, I've been working in NHS Mental Health Trust in specialist trauma clinics, where we developed through randomized control trials effective treatment, psychological treatments to treat post-traumatic stress disorder. I've also been the post-traumatic stress disorder lead for the Trust, South London and Maudsley. Unfortunately, because of events such as terrorist incidents, I then moved on to develop and lead services for survivors of terror. That was been both the British survivors from Sousse, Tunisia, Brussels and Paris in 2015, then in London, the 2017 events, and then Fishmongers Hall in 2019. I've also did quite a lot of work with supporting medics and colleagues, both those going to Sierra Leone with the Ebola pandemic, but then I was seconded to NHS England during the COVID pandemic to develop services for our NHS colleagues and social care colleagues. I've done some work with the International Organization for Migration. I'm going to mention this a little bit more with women who were trafficked for sex, as well as developing services for veterans. Other than that, I've had the pleasure during my career to be part of King's College, University London, where I was an academic director for clinical psychology, but also leading on the trauma course. The reason why I mention these things is because, as I said, these are the things that sort of shaped the understanding that I'm going to share with you today, and also for the panel discussions, if there is any questions, kind of these are the things that I kind of know about. So yes, what I would like to share with you is insight on the psychological impact on trauma on women. Talk about why women are more susceptible for post-traumatic stress disorder. Give you a hopeful message in terms of how can we effectively treat and support women who've been affected by violence and by post-traumatic stress disorder. As Lorna has mentioned, this is a critical issue. It's a global issue that 1 in 3 women experience physical and sexual violence in their lifetime. Understanding the psychological toll of this violence is essential for us as professionals, caregivers, and society as a whole. What is the psychological impact of trauma on women? Trauma, particularly in the form of violence, sort of interpersonal trauma, can have a profound psychological impact on women. Post-traumatic stress disorder is one of the most common disorders that result from trauma, with women being twice as likely than men to develop post-traumatic stress disorder after traumatic events. And the question, why is it? Why is it that women develop PTSD, which includes flashbacks to their trauma, nightmares, heightened anxiety, and avoidance of activities that they used to do, talking to people about what happened, and going to places that they used to go freely before? The symptoms often make it difficult for survivors to function in their everyday life. And it's important to note that PTSD not only affects the mind, but it also affects people physically, with people suffering from difficulties with sleep, hypervigilance to danger, and increased startle reactions. So why is it that women suffer more from PTSD than men? So women are more likely to experience sexual violence and physical violence, and that's a big contributor for the higher rates of PTSD. But research suggests that that's not the only reason. Women tend to experience more interpersonal trauma, domestic violence. That deeply undermines the sense of safety and trust, particularly when exposure to trauma starts at an early age, particularly when it comes from caregivers. Additionally, we do have some studies that are actually looking at the psychobiology. And what we see is actually that there are differences with women having hormonal differences, more likely to respond in a way that is more likely to increase their symptoms. It's also about how women tend to cope with adversity and with trauma. Women tend to actually seek support, which is a good thing, but when that social support is not there, when it's absent, then actually that it becomes, and negative social support is the highest risk factor for developing PTSD. So that what should be a positive coping can become actually the highest risk factor. Of course, the other side of it is also the gender roles in our society, having less power. Any population that is prejudiced, is discriminated, is more likely to suffer from the impact of psychological trauma. We know that. So what has my career taught me? What I've learned over my career and working with countless women who've endured violence is that although the road to recovery is challenging, it is possible with the right support. In the NHS, the National Health Service, in the outpatient clinics, we have effectively treated many trauma survivors using therapies such as trauma-focused cognitive behavior therapy and eye movement desensitization and reprocessing, EMDR. These treatments are recommended by NICE, the National Institution for Clinical Excellence, and have been proven to reduce PTSD symptoms such as flashbacks, avoidance behaviors. Treatment also helps to address deeper feelings of shame and guilt, which can often be hidden beneath anger, perfectionism, or high self-demands. A note on treatment challenges. One of the challenges we face is that many women can't fully remember their traumatic experiences, whether because they were drugged, whether because they were unconscious, because they were beaten, or because they dissociated during their trauma. Despite these memory gaps, therapies like EMDR and CBT can still be incredibly effective. Through these treatments, we help women process their trauma, allowing them to regain control over their lives, or in some cases, build new ones. Early childhood trauma. Recovery is especially challenging for women who have suffered abuse from an early age, when the abuse comes from a caregiver. Research shows that early childhood trauma can have a lasting impact on brain development, affecting emotional regulation and attachment patterns. For these women, therapy becomes a lifelong process of rebuilding their sense of self-worth and trust in others. Many of these women stay in touch with me and with my colleagues, sharing both their successes and their setbacks as they continue to navigate the long path of recovery. A profound learning experience that I had on this journey was when I was invited by the International Organization for Migration to train counselors working in a shelter in Macedonia for women and girls that survived sex trafficking. The first thing that was needed for their recovery was to establish a sense of safety. For women who had been deprived of basic needs, sleep, food, medical care, the initial goal was to help them regain control over their daily lives. This was difficult because traffickers were still a threat, often waiting outside the shelter. Working with the counselors, I learned about the importance of caring for the caregivers. What I was astonished to find out was that the staff themselves were working under dangerous and financially unstable and stressful conditions, and their well-being was essential to the care that they were providing. This experience taught me that trauma recovery isn't just about treating the survivor. It's about creating a safe environment and ensuring that people supporting survivors are cared for as well. Without this holistic approach, true healing cannot happen. Yes, good move to this bit. So this is the work that I'm currently doing, the London Major Trauma Centres. So in this current role, we're developing psychological services in major trauma centres in London. I don't know if you know, but here in London since 2010, we've got a major trauma network of hospitals where we're treating people who've had multiple injuries, often that are causing real threat of life. And the survivor rates have really improved. What those services didn't have is they didn't have any psychological input. So since last year, since 2023, we've got psychology teams in these services. And this is the work that they're doing. They're providing education and training to their colleagues, the doctors, the nurses, to make sure that the treatment that is being given is psychologically informed, is trauma-informed. They care for the patients at the bedside. They also look after patients once they've been discharged from hospitals. They also support their families. Those psychologists, those team, not only integrate the psychological care and the physical care when people are in hospitals, they're also ready to be stepped up when there's a major incident in London. And we have a bigger piece of work with lots of wider stakeholders in London to prepare to provide psychosocial and mental health care for in cases of major incidents, so that we're not in the same place where we were back in 2017 when we had those incidents here in our capital. But going back to our topic, what I've learned in this role, what I've seen, is how crucial it is to offer support right at the point of physical recovery. While some of the original focus that we had was that we thought we were going to treat a lot of victims of street violence. That is true, we do that. But we also realized that many women who were admitted due to injuries from domestic violence or gang-related incidents were beginning to open up to us about their abuse in the hospital setting. Having psychologists available at their bedside has enabled us to intervene early and link them to crucial services such as police liaisons, independent domestic violence advisors called IDVAs, and safe housing support. This early intervention could be life-changing. I can tell you about in the next slide, about a recent success story involving a woman who was brutally attacked by her partner. My colleague, Dr. Simmons, went to her room. She didn't know anything about it. The woman was kind of lying in a room, isolated, without a phone, quite confused and distressed. The police has taken her phone because of evidence. She didn't know where her 4 children were. Through trauma-informed psychological support, we helped her to get information that she needed from the police, and she was able to provide crucial evidence against her abuser. That led to his conviction. The flowers there are the flowers when she came months later back to Dr. Simmons to say thank you, because he was convicted for 19 years. She was then rehoused with her children and was able to return to work. This case shows the power of psychological support in not only helping survivors recover, but also can help in securing justice. How many of you work in professions where you've seen firsthand the difference of early interventions that can make on survivors' lives? It's not just about psychological recovery. It's about helping people to rebuild their lives and hold their abusers accountable. One of the key lessons that we've learned in the trauma centres is the power of collaboration. When multiple agencies, healthcare, police, housing and social services work together, we can provide a comprehensive response that truly supports survivors. Attending multi-agency risk assessments conferences, MARACs, and working with safeguarding teams has allowed us to identify women at high risk of harm and offer them life-saving support. In conclusion, I hope that I've been able to convey a hopeful message. Evidence-based treatments like trauma-focused CBT and EMDR offer real, measurable help for women and girls affected by violence. However, we must also push for better coordination between services to ensure that survivors receive the comprehensive care they need. Let me leave you with this thought. The trauma survivors we work with are often facing unimaginable challenges, but people are also incredibly resilient. Our job is to create a safe space for them to heal, while also ensuring that the systems around them are robust and supportive. To achieve this, we must strengthen our networks care for our teams, and continue learning. Finally, a lesson I've carried with me from my work in shelters during the Ebola outbreak and through the COVID-19 pandemic is that those of us who care for survivors need to care for ourselves and each other. The work we do is vital, but it's emotionally demanding, and we must sustain our own well-being if we are to continue supporting those in need. Thank you.